Our final guest today is Dr. Lydia Labocetta of Novant Health Urology Partners. Welcome back to the show today, Dr. Lydia Labocetta. How are you?
I'm great. Thanks for having me again.
Oh, it's always a pleasure to have you. You're so much fun. Now, there might be somebody out there who didn't meet you before, so let's let them know about your education and your background, okay?
Sure. Yeah. Well, my background was actually in theater. And
I know. It's so exciting.
Yeah. I don't get to do a lot of that now. But, I did my medical school training kind of after all that. And so I was in medical school in Norfolk, Virginia, and then I did my residency training down in Charleston, South Carolina. And my husband and I always knew that we wanted to move back to this area, so that was kind of our goal right along, to be back here somehow doing something.
Yeah, sometimes I forget you're actually from Wilmington.
Yeah, my grandmother was reared in Winter Park.
How cool is that? Yeah. And I remember she's a seamstress, right? Didn't she sew?
She does. She is. She wears a lot of different hats, but
Yeah.
she taught me how to sew.
Yeah, that's great. I always think that's so fascinating. So, you've been with Novant Health Urology Partners for quite a while now.
Yeah, going on 4 years.
Yeah, that's great. Seems like yesterday you were on the show and it was like our first few shows, and that was so
flies.
cool. Yeah. Well, today I think we're here to talk about a specific topic, and that is incontinence and other women's pelvic floor health conditions, right? So what are some of the most common pelvic health conditions that you treat for women?
I would say the most common things are related to urinary issues, specifically, just because usually people don't necessarily think of a urologist when they're dealing with prolapse issues and things like that. But definitely a lot of urinary tract infection, a lot of urinary urgency, frequency, and leakage problems. The leaky ladies.
The leaky ladies. Well, tell me a little bit about those conditions and what those symptoms, how they present.
Well, I think that it's one of those things that is really frustrating to me about women in general. I think that we just don't advocate for ourselves very well.
You're right.
You know, I think that women are willing to put up with a lot and are inclined to assume that nothing can help them. And so one of my kind of frustrations and missions is really to work on getting people to just come through the door. Because, you know, I think that a lot of these urinary incontinence issues present, instead of really just presenting with leakage, it presents with like not playing with your kids. You know, it presents with not going swimming at the ocean because you're afraid that somebody's going to see that your bathing suit is a little bit damp, you know? And so I think that one of my goals is really to say, okay, we can't all be 17 again, and we can't all be perfect, but we can definitely do better. And I think that every woman is entitled to the joie de vivre that comes with just enjoying your life. And if you're paying attention to your stupid bladder all the time, then you're not enjoying your life.
Right.
It's really anything that's occupying that much focus and attention is not allowing you to really enjoy your life. And quality of life is so important to urologists. I think that's relevant.
Yeah. So I would think that some of us might think we're just getting old. And so we think that's normal.
And I really hope not, because I'm not that old, and and I don't want to be having those problems when I'm older. And I see so many women who are older who are not having those problems. So I do think that there are certainly some physiologic changes that happen with aging. You know, I mean, if you've had big babies, you know, there's a good chance that that the pelvic floor has been disturbed, changed, your anatomy has been shifted. Definitely there are changes in the vaginal environment that come with aging that can be remedied. And, you know, again, we're not all going to be 17 again, but we can certainly do better. And okay, yeah, maybe sometimes patients have to wear a panty liner still after treatment, But if you're not wearing a thick pad and you're not worried about, oh, well, I'm going on my cruise to Disneyland, I better make sure that I take a suitcase full of undergarments. I mean, that's a real quality of life issue that patients don't even realize until it's not there anymore. And I hope that we are able to get the word out and get some patients to come in and just talk about these things.
Yeah. Well, if a woman finally gets the courage to come to your office and to talk about these things, what do they typically say once they've had the treatment and are maybe improved? What would they say?
Oh, I mean, I think, again, it's one of those things that you don't even realize how much it's affecting your quality of life until it's not anymore. I tell people it's like the hiccups, because you get the hiccups and you kind of almost get a headache from the hiccups, and then the hiccups are gone and you're like, where'd the hiccups go? It's kind of like that. I think that it's something that just affects you so much more than you even realize. That most of the patients, I see a number of patients who are just so glad.
Do they all wish they'd been there sooner?
Yeah, absolutely. A lot of patients say, you know, I just wish that I had known about this earlier, or come in sooner, or had the courage to talk to somebody about it sooner.
Yeah. Well, let's talk specifically about incontinence. Tell me about some of the treatments that you would apply for that.
So first we have to sort out whether patients are having urge incontinence or stress incontinence. They're very different, and the treatments are different. The treatment for stress urinary incontinence is, it's an anatomic problem, so we can do exercises. And data have shown that most women who do the exercises, if their stress incontinence is bad enough, end up requiring surgery. And so we start counseling patients early on about surgical options for the stress component. And that's like coughing, sneezing, jumping on the trampoline, running after your kids, that kind of thing. As far as urgency and urge urinary incontinence are concerned, that is a behavioral problem really more than anything else. It's It has to do with that idea that it's just part of getting older.
I told you.
And, you know, hitting up every single bathroom along the way, and basically just training your bladder.
I have a friend who says, I never pass up a bathroom, just in case.
I have about 873 patients who say that. And that's, that can kind of work against you, because the smaller the less volume your bladder stores, the less it wants to store. So one of the things that I work with patients on is just really delaying that void and using medications if we need to help make that happen. And even Botox injections for patients who are really having debilitating urgency and frequency.
A while ago in the interview, you talked about prolapse, as a pelvic organ prolapse. Explain to me what that is and what kind of treatment.
Sure. So pelvic organ prolapse can sometimes contribute to urinary symptoms because the vaginal vault is like it's like an old coffee can. So imagine an old coffee can with three sides.
Okay.
So, you know, the coffee can really has to be intact all the way up. Okay. And so in the female vagina, you can have the bladder come down on the front side of the vagina. You can have the rectum come down on the back side of the vagina, or you can have the whole thing almost slinky out. And so by identifying the different compartments that are being affected by prolapse, we can help to address both urinary issues and also functional issues related to discomfort during intercourse and that sort of thing.
And I assume that would probably require surgery for something like a prolapse?
Definitely surgery is one option, and there are lots of different types of surgical options. So we can do transvaginal surgeries. We can actually do a surgery for prolapse through the belly with the robot, and that's called a robotic sacral colpopexy, which is a really cool procedure and has been
shown. And you perform that, correct?
Yes, and that way has a slightly decreased risk of discomfort during intercourse. And also, pessary is a great option for patients that just don't want surgery, but are having some functional outcomes that are being affected by their prolapse. And that's basically, it's like a plug.
Like a plug.
To just hold everything up inside.
Oh, well, that doesn't sound too bad. Well, before we wrap up, is there anything that you would like to add for our viewers?
Absolutely. I think, as a surgeon, obviously the things that I always think about are surgical because I'm a fixer. I like to fix things quickly.
Sure.
But we have an excellent resource in our community. There's a pelvic floor physical therapist, Ashley Harrington, who works with a number of my patients. And I think, especially for patients that hear the surgery word and are just totally turned off by that, I still would encourage them that there are lots of different options, and physical therapy is one of those that's very advantageous.
And you would provide a referral for any of your patients to that office?
Absolutely. We work together pretty closely.
Great.
And oftentimes my surgical patients end up using physical therapy as a component of their treatment also. So I think that's an important piece.
That sounds wonderful. Well, I can't thank you enough for being here today. You're always a treat and always such fun. We laugh a lot. So how about your office number? Do you know your phone number?
I do know my phone number. It's 910-721-4150. And Debbie and Amy are our schedulers, and they're wizards. They find places for people that are almost impossible. So
awesome. Well, thanks again for being here.
Thanks for
I
having
look
me.
forward to you coming back again. You're always so much fun.